Imagine watching your baby sleep peacefully, and then noticing something on his leg that wasn't there yesterday. A bump, soft to the touch, growing, and not a single doctor in the room can tell you what it is. That is the reality one mother in the Netherlands faced when her 7-month-old son developed mysterious lesions that stumped not one but 2 medical professionals and left an entire family waiting, watching, and praying for answers. This is that story. 4 weeks before this mother reached out for help online, her infant son, just 7 months old, barely able to sit up on his own, spent a night in the hospital. He was sick, running a fever, miserable, and dealing with a double ear infection that had him crying through the night. The doctors admitted him, monitored him, and prescribed amoxicillin, a standard antibiotic used commonly in young children for exactly this kind of infection. For most families, that would be the end of the story. A rough week, a full recovery, back to normal. But for this family, the hospital stay was only the beginning. 2 days after her son was admitted, something strange happened. Spots appeared. Not a rash exactly. Spots on his hands, on his feet, on his legs. They came quietly without warning, and at first the family thought they recognized what they were looking at. Hand, foot, and mouth disease is incredibly common in infants and toddlers. It causes sores in exactly those locations. It's uncomfortable and alarming to look at, but it resolves on its own. So the family watched and waited, expecting the spots to fade. They did not fade. Instead, they scarred over. And then something new appeared. A bump. One significant bump on his leg, appearing roughly a week before the mother asked for help. It started the same way the other spots had, small, unremarkable at first glance. But unlike the others, this one grew. It became large enough to be clearly visible in photos she took to show doctors. Large enough to be undeniable. And still, no one could explain it. Let's think about what this family was dealing with here. Their son was 7 months old. He weighed about 8.5 kilograms, a perfectly healthy size for his age. He had never traveled outside the Netherlands. There were no exotic exposures, no unusual environments. The family had a cat and a dog at home, which is worth noting, but no other family members, not the parents, not any siblings, had developed similar spots. This was not a household outbreak. This was one small baby, and whatever was happening exclusively to him. The mother took him to their general practitioner. The GP examined the spots, looked at the growing bump, and had no clear answer. So they were referred to a dermatologist, a skin specialist. And the dermatologist, after examining the lesions up close, also had no definitive answer. 2 doctors, 2 professionals trained to look at exactly these kinds of problems, and the response from both was essentially the same. We're not sure what this is. They tried treating it anyway. Fusidic acid ointment was prescribed, a topical antibiotic commonly used to treat bacterial skin infections. Then Bactroban, which is mupirocin, another antibiotic ointment used for similar purposes. Neither seemed to be doing anything meaningful. The bump continued to grow. Eventually, the decision was made to take a biopsy, to remove a small sample of tissue from the bump and send it to a laboratory for analysis. During the procedure, something notable happened, or rather, something notable did not happen. When the biopsy needle went in, there was no pus. In many skin infections, abscesses, boils, infected cysts, you would expect to find a pocket of pus, a collection of fluid and immune cells that signals a classic bacterial battle happening under the skin. But there was nothing like that here, just soft tissue. Whatever was inside that bump, it wasn't a straightforward infection in the traditional sense. And so the family waited. Biopsy results take time, days, sometimes more than a week. They went home with their 7-month-old, watching him carefully, hoping the bump would stabilize. It did not. The bump got bigger, and then new spots began appearing. At this point, the mother made the decision that every parent in this situation eventually has to make. She stopped waiting for a scheduled appointment and took her son to the emergency room. This was the right call. When something is actively progressing, when new symptoms are appearing and existing ones are worsening, that is not a situation to manage on a waiting list. At the emergency room, the medical team moved quickly and comprehensively. A swab was taken from the baby's throat, a swab was taken directly from the fluid in the bump, and a significant amount of blood was drawn for laboratory analysis. They were casting a wide net, trying to catch whatever this was in the data. The initial blood results came back, and here is where the story takes a complicated but somewhat reassuring turn. They were normal. No elevated inflammation markers, no low blood count, no signs of reduced immunity. This is important. In serious systemic infections, in conditions like sepsis or severe bacterial illness, you typically see the blood count change. White blood cells surge, inflammatory proteins spike, the body's alarm system shows up in the numbers, and in this baby's case, those numbers looked stable. That ruled out several frightening possibilities, but it also left the mystery intact. Treatment with azithromycin was started. Azithromycin is a broad-spectrum antibiotic, different from what had been tried before, capable of targeting a wider range of bacterial organisms, including some atypical bacteria that don't respond to the standard antibiotics this baby had already been given. The medical team wasn't waiting for a confirmed diagnosis to begin treatment. They were acting on clinical judgment, choosing a medication that might work while the culture and biopsy results were still pending. The family was told they would discuss all the results with a pediatrician on Monday. And if things had not improved, if there was still no clarity, the next step would be a referral to a dedicated children's hospital in Utrecht. In the meantime, the family was given direct access to the pediatric ward. If anything changed in their son's health, anything at all, they were told to call immediately. The mother noted something at the end of her update that stands out. She said it was good that this was finally being taken seriously. That sentence carries weight, because it implies that earlier in this process, she felt like it wasn't being taken seriously enough. And she was probably right. 2 doctor visits that produced no diagnosis and no aggressive follow-up plan for a growing lesion on an infant, that's a gap. It took a parent pushing harder, going to the emergency room, demanding more to get the level of response her son needed. So what can we take away from a story like this one? The first lesson is straightforward but critical. Trust your instincts as a parent. This mother knew something was wrong. She knew the spots weren't normal. She knew the bump was getting bigger. She photographed it, documented it, brought it to multiple doctors, and eventually took her son to the emergency room when outpatient care wasn't moving fast enough. That persistence matters. Medical professionals are human. They have blind spots. They have busy days. They see pattern matches. And when something doesn't fit a pattern, it can get overlooked. Your job as a parent is to keep pushing until someone takes it seriously. The second lesson is about documentation. This mother photographed the spots from the beginning. She tracked the progression. She noted when new spots appeared. She had a timeline. When she described her son's situation, whether to a GP, a dermatologist, or an emergency room physician, she wasn't relying on memory alone. She had evidence. That evidence helped doctors understand what they were looking at. If you notice something concerning on your child's skin, photograph it. Date your photos. Keep records. It seems simple, but it can change how a medical conversation goes. The third lesson is about knowing when to escalate. Outpatient care, a GP visit, a dermatologist referral. These are appropriate first steps for most situations. But there is a threshold. When a condition is actively worsening, when multiple treatments have failed, when a qualified specialist cannot give you a diagnosis, that is when you stop waiting for the next scheduled appointment and go somewhere that can do more. Emergency rooms exist for exactly this reason. They have more resources, more testing capacity, and the ability to act quickly. And finally, understand that medicine does not always move as fast as fear does. Waiting for biopsy results is agonizing when it's your child. Waiting for culture results, for specialist referrals, for answers, it feels unbearable. But many of the most important tools in medicine take time to return results. The waiting is part of the process, not a sign that nothing is happening. What matters is that someone is watching, that someone has ordered the right tests, and that someone is on call if things change. As of the last update in this story, the family was still waiting. The baby was being monitored. Azithromycin had been started. A referral to a children's hospital remained a possibility. This story doesn't have a clean ending yet, because real medical situations rarely do. But this family was in the right hands, finally, and moving in the right direction. If something like this has happened to you, a mysterious skin condition on your child, a bump that no one can explain, a feeling that your concern isn't being heard, do not stop advocating. Keep pushing, keep documenting, and keep going back until you get real answers. If this video helped you or gave you something to think about, please subscribe. Every week we cover real health stories from real people. The kind of situations that don't make medical textbooks, but do happen in living rooms and pediatric waiting rooms all over the world. Hit subscribe so you don't miss what's coming next.